My apologies, I understood I was muted there. Hello, everyone, and welcome back to the Unite Global Summit. It's great to be here, and today, now especially because I'm with a very, very dear friend, Dr. Jose Zuniga, who will be speaking and delivering a 10-minute keynote speech here at our summit with the title, Bringing the Gap Between Urban and Global Responses to Public Health Threats. Dr. Zuniga was appointed president of the International Association of Providers of AIDS Care, 𝗨𝗚PAC, in 1999, after having served as 𝗨𝗚PAC's vice president for programs charged with advancing the association's medical education and technical assistance initiatives. Prior to joining 𝗨𝗚PAC, Dr. Zuniga served as Director of Strategic Communications at the AIDS Action Council in Washington, D.C., following his military service in the U.S. Army. Dr. Zuniga is an 𝗨𝗚PAC trustee, technical consultant with the Collaborative Institute of Virology, and a member of the Joint United Nations Program on HIV/AIDS, known to all of us as UNAIDS, Scientific and Technical Advisory Committee. He is one of the co-signers of the Paris Declaration on fast-track cities and spearheads 𝗨𝗚PAC's efforts as the core technical partner for the fast-track cities initiative. And also, may I add that 𝗨𝗚PAC, led by Dr. Zuniga, will be organizing a two-day virtual conference starting tomorrow, in which I will have the honor of participating in its closing session on Thursday. And I would like to congratulate my dear friend for putting the session together. It was supposed to be here in Lisbon. We will do that sooner than later, I am sure. But most importantly, to show the importance of local leadership, and having been a deputy mayor of 𝗕𝗄𝗄𝗃, very near Lisbon, and having worked in local government myself, I can only stress the importance of the roles of mayors, of cities, and of organizations like your own, bringing together all the different stakeholders, including, of course, the community, to getting responses where they are needed to end AIDS as a global health threat, achieving also the 95-95-95 goals through the fast-track cities movements. Zuniga, the floor is yours.
Thank you very much, Ricardo. I want to acknowledge your leadership in coordinating the Unite Summit, but more importantly, in coalescing parliamentarians around the world to take strong actions to achieve Sustainable Development Goal 3.3. Both are commendable and, in my estimate, the essence of public health leadership. We at 𝗨𝗚PAC, and certainly the Fast Track Cities Institute, are proud of our partnership with Unite, including in coordinating these back-to-back global events this week. The Unite Summit, dedicated to bolstering national responses to infectious diseases and looking as well at the importance of pandemic preparedness within the context of COVID-19. And as you just mentioned, our virtual Fast Track Cities 2020 conference, which is focused on highlighting the work that more than 300 fast track cities around the world are striving to do within the context of COVID-19 to maintain a continuity of HIV, TB, and viral hepatitis responses. I want to open by synthesizing my message at the opening of tomorrow's virtual Fast Track Cities conference by speaking to the concept of city multilateralism, which describes the diplomacy and action that's taken at local level to coordinate with global peers on transnational concerns, as we certainly are doing in the partnership between Unite and 𝗨𝗚PAC. In essence, what we're calling for in increasing city multilateralism is increasing efforts to coordinate the work of municipal governments with national and global efforts, because this is, to me, key for achieving the SDGs, but also, as we see today, for pandemic preparedness. City multilateralism, to me, is in addition to national health diplomacy, not a replacement. It's a requirement for decentralization of a traditional health diplomacy model that has placed nation states as central actors, and an actioning of city multilateralism as a national urban partnership in much the same way that Unite and 𝗨𝗚PAC are demonstrating a national urban partnership through our back-to-back events. I think if we ever needed to make a case for city multilateralism, Just think of the mitigating effect that cities and municipalities are having in nations that are failing to lead evidence-based COVID-19 responses. Tomorrow at this virtual Fast Track Cities 2020 conference, we will hear from several municipal leaders, some of whom have had to buck the system and have had to go against governors to speak to the importance of evidence-based approaches to epidemic control. City and municipal leaders are leading in the face of paralysis at higher levels of government, including in the United States, Brazil, and elsewhere. I consider it a matter of urgency that we meaningfully advance this concept, and my rationale is the speed and scope at which urban growth is occurring around the world. According to UN Habitat, 30 years from today, roughly 2 in 3 individuals will live in urban centers, with 90% of this growth due to occur in regions such as Sub-Saharan Africa and East and South Asia. Today, more than ever before, we see the necessity for cities and municipalities to be on the forefront of advancing public health and basic human rights. I thus ask parliamentarians and other national leaders not to relegate municipal leaders to the sidelines or as a mere afterthought in developing health diplomacy or in preparing for the next emerging pandemic. We need city multilateralism so that fast-growing urban zones, which are poised to become more populous in the decades to come, can serve as the engines for change and innovation. We need city multilateralism to ensure that if we ever confront, again, a time in which national leaders fail to lead, city and municipal leaders can do so. As I'm proud to say, city and municipal leaders across the network of Fast Track Cities are currently doing today around COVID-19, HIV, TB, and viral hepatitis. Again, I appreciate our partnership with Unite around Fast Track Cities. I know that Ricardo, as he just mentioned, as a former deputy mayor, but also Unite's leadership, views city multilateralism as an opportunity rather than competition to be hindered. Through our continued partnership, I'm convinced that we can get through the COVID-19 pandemic and the epidemics of HIV, TB, and viral hepatitis and confront future public health challenges. Thank you so very much to all of you, and please continue your good work and stay safe.
Thank you so much, Jose, for your kind words, for reinforcing the importance of our partnership. And let me take this opportunity to ask anyone who is watching, if you haven't registered, to do so as soon as possible for the Fast Track Cities conference starting tomorrow, where we will certainly be, and I will be speaking also at your closing ceremony. So thank you once again. It has been a great honor for us to join efforts, and hopefully joining those efforts, we will be able to better respond using both urban and global responses to these public health threats, especially in the midst of the challenges that COVID-19 has posed us. And so we look forward to seeing you at your Fast Track Cities virtual event tomorrow. I'd like to thank everyone for watching. And before we transition to the next panel with Unite's Global Board, in which we will be also unveiling a message from the Secretary General of the United Nations, 𝗏𝗏𝗏 Guterres, we will first take a very, very short break to allow the speakers to come on stage. So please don't go anywhere. Thank you, and we will be right back.